Hello, my name is Adrian Geeslin. Today I'm presenting a community health assignment for Dr. Fisher's N493 course at Aspen University. Throughout my presentation, I will discuss the determinants of health in low socioeconomic families. Objectives today describe how children are affected by poverty and the core determinants of health contributing to their ill well-being. The important role of the Head Start program in reducing some disparities is also explained. Children who live in poverty. Families in poverty lack life's basic necessities. Within the United States alone, roughly 15 million children experience poverty. Children's development, health, and psychological well-being are tremendously impacted by the effects of poverty. The determinants of health. Children's well-being is affected by health determinants based on where and how children live, learn, grow, and play. Poverty alone is a powerful determinant, affecting health, living conditions, education, finances, and social environments. Impact on health services. Poverty impedes access to health services. Families cannot afford the healthcare costs, they lack means of transportation, and have limited services available to them. Preventative care and treatment of ongoing health conditions are nearly impossible, causing delayed care and preventable hospitalizations. In addition to the lack of resources, many families feel shamed and judged by their healthcare providers, often being viewed as non-compliant, when in reality, many families want to be compliant and follow up with care, but they do not have the means or availability to do so. Impacts of education and health literacy. Stress within a child's living environment affects early brain development, making learning difficult. High school diplomas and college education rates are significantly lower in low-income families. Adults within the household are likely to have lower levels of education, making it difficult to attain stable paying jobs. Low health literacy among caregivers contributes to the lack of proper nutrition, preventive measures, and medical treatment. Impact of social environments. Poverty often results in high stress, conflict, violence, and abuse within the home. Parents are frequently absent, leaving kids to be raised by older siblings, extended family members, and foster families. These children are easy targets for bullies and abusers. Severe trauma and psychological conditions are highly prevalent. Impacts of physical environments. Low-income families often live in high-risk neighborhoods. Health is affected by polluted air, poor sanitation, and contaminated water. Living arrangements are frequently overcrowded, causing the spread of infectious diseases. Availability of community resources are scarce within these areas. Impacts of financial status. The financial strain of living in poverty limits resources and increases unhealthy and unsafe living conditions. Finances take a toll on physical and mental health, increasing risks for abuse and overall impairs the well-being of all involved. Children enrolled in the Head Start program. Children and their families rely on the assistance and available resources that the Head Start program has to offer. Children receive adequate education, psychological, dental, and medical screenings. followed up with accessible referrals and resources with a means of transportation. Social services are available to assist with nutrition, housing, clothing, mental and physical health services. Brain development begins within the womb and progresses through childhood and even through young adulthood. Head Start offers services starting in pregnancy within mothers and up through the first 5 years of childhood. Educating these families on the importance of infection prevention is imperative to keeping the classrooms open, resources available, and the children healthy. Lastly is my list of references. Thank you for listening today.